Welcome to final part of valvular heart disease. I'm Dr. Rahil here, and in this video we will learn about tricuspid stenosis and regurgitation. In tricuspid stenosis, there is reduction in the size of the valve orifice, which results in the obstruction of blood flow from right atrium into the right ventricle during diastole. This can result in elevated right atrial pressures. Chronic elevated right atrial pressure lead to signs and symptoms of systemic venous congestion. Rheumatic heart disease is the most common cause of tricuspid stenosis. Pure tricuspid stenosis is very uncommon, and the most cases present with tricuspid regurgitation or a combination of regurgitation and stenosis involving other valves. Coming to clinical features, dyspnea and EC fatigability are common symptoms. Physical findings include raised jugular venous pulsation, hepatomegaly, ascites, and peripheral edema. On cardiac auscultation, a diastolic murmur, which is best heard at the lower left sternal border in the fourth intercostal space. It is usually softer, higher pitched, and shorter in duration than the murmur of mitral stenosis. The intensity of the murmur in tricuspid stenosis increases with inspiration, also known as Carvalho sign. Transthoracic echocardiogram with Doppler flow is investigation of choice. Most effective therapy for severe tricuspid stenosis is valve replacement. This concludes the discussion of tricuspid stenosis. Now we will learn about tricuspid regurgitation. As we already know, tricuspid valve is present between right atrium and right ventricle. In tricuspid regurgitation, the valve does not close properly, leading to backward flow of blood from right ventricle into right atrium during systole. Tricuspid regurgitation is a relatively common abnormality. A small degree of tricuspid regurgitation is present in approximately 70% of normal adults. Primary tricuspid regurgitation can be due to congenital abnormal valve morphology, but the clinically most important form is secondary to left-sided cardiac diseases that induce pulmonary hypertension and secondary right ventricular dilatation, leading to tricuspid annular dilation. Other causes of tricuspid regurgitation are endocarditis, carcinoid heart disease, pacemaker lead entrapment, and tricuspid valve prolapse or following trauma. There are often no specific symptoms associated with mild or moderate tricuspid regurgitation alone. With severe disease, there may be a sensation of pulsation in the neck from the distended and pulsatile jugular veins and symptoms of right-sided heart failure such as painful hepatosplenomegaly, ascites, and peripheral edema. Other symptoms are dyspnea and fatigue. Important findings on physical examination include raised jugular venous pulse and a holosystolic or pansystolic murmur that is best heard at the right or left mid-sternal border or at the subxiphoid area. Echocardiography is the main diagnostic modality for identification of tricuspid regurgitation and evaluation of its severity and cause. The management of tricuspid regurgitation is guided by the underlying etiology and the pathology of the tricuspid valve. Tricuspid valve repair or replacement is recommended for severe symptomatic tricuspid regurgitation. And with this, we have completed the discussion of valvular heart diseases. Thank you for watching. In the next video, we will learn about diagnosis and management of heart failure. Till then, take care and goodbye.